welcome everyone to the ADAT orientation. I'm Dr. Ahmed Hafez from Scholars Dental. We have with us Dr. Ramneek from Scholars Dental, our ADAT specialist that's going to help you with ADAT exam.
Hello, everyone. Good morning.
Introduce yourself, and you could ask her anything today about ADAT. I'm going to be just on the side. So go ahead.
Good morning, everyone. Hi, I'm Dr. Ramneek. I am ADAT instructor with Scholars Dental. So I have been a student of Scholars, and I have gained extensive knowledge from them. And post that, I gave my ADAT and went through it. I know the structure, how the exam is. So today I'm here to help you. You can ask me any questions right from the beginning, like what is ADAT? How do you want to register for it? How the universities are going about it? What do you want to study for it? And the most important question, how much score is enough to get a call from the universities? And the most important question is, like, it's a bridging course. So how we as a team, as Scholars Dental team, how we are going to help you navigate that path. So we all will be discussing about this today. I'm going to share my screen. So we have a small presentation for you all. We'll be covering the most common questions which you guys have. And if you have any questions apart from that, please feel free to either drop a comment in the chat and we'll get back to it, or you can just raise your hands and we can resolve the questions right away.
And I'll be
Dr.
also
Hafez?
on their behalf jumping in and maybe asking questions too, annoying you a bit with that, and then you can...
For sure, for sure, for sure.
All right.
I'll be sharing my screen now. Okay. Okay, let's share the screen.
Just a little reminder for everyone too that the ADAT course is officially starting tomorrow. So, sorry, tomorrow, yeah, Sunday.
Tomorrow, yes.
But the live sessions will be recorded, so in case you're a little bit late, it's not a big issue. Okay, so all right, let's get started.
So welcome everyone. An official welcome to everyone for the ADAT Orientation 2024. So let's jump into it. The first most important question is, what actually is ADAT and who should apply for ADAT? So we have a mix of audience here. Some of you might be knowing what ADAT is, and some of you might have researched it well, and some of you are new to it. So to get into the background of that, ADAT, that is American Dental Admissions Test, is a test which is instituted by ADA, that is American Dental Association. So it's an American exam.
Advanced dental, is it advanced?
Yes.
Yeah.
Advanced Dental Admission Test.
Yeah.
Given by ADA, that is American Dental Association. So it's an American test, and it was initially meant for students who are going to apply for advanced dental education programs in US. So from 2000,
sorry, just to kind of, so what I know is that, like, when you want to do a specialty in the US, they use ADAT. Is that correct? Yeah.
Yes. So there are around list of 400 plus programs in US which take ADAT. Some of them compulsorily require ADAT, and some of them consider ADAT. So for that, we have to review each program where we are interested. However, because now Canadian universities are considering ADAT for their IDA programs, so that's where the more important discussion comes into. So McGill University in Canada, they started considering taking ADAT scores for their IDA program requirement. Post that, in 2022, University of Toronto said that they will also take ADAT scores for their IDA program. And now we have 3 more universities who are considering that, which we will discuss now. So that is ADAT program. So ADAT program is basically an exam which is evaluating your clinical decision-making skills. Like how good you, yes.
And also, right now, we also have a blog and a YouTube video about which universities are doing ADAT, like are taking ADAT. And I think by 2025, admission is like 90% of
Five.
them, right?
Yes.
All like, yeah.
5 universities, 5 out of 7. Yes.
Okay.
Okay. So that is for ADAT. So who should apply for ADAT? If you are an international student who is interested in taking an admission to Canadian universities, these 5 out of 7 universities who offer IDAP program, if you are interested in taking an admission in the university, then you should take an ADAT program this year, because by 2025, the 5 universities are only taking ADAT. Second, if you are a graduate of either an American university or a Canadian university, or even if you are an international student, but you are interested in an American advanced dental education program, that is a specialty program, you should take an ADAT. So if you fall under any of this category, it is important that you take ADAT this year. Okay. So any questions so far? Anyone?
I think it's clear. So basically, guys, why is this
Yeah.
important for you as international trained dentists in Canada? Because for the university pathway, ADAT is going to become the standard, right? So far. So um, that's why it's important for you guys. Now, do you want to discuss what is the ADAT internally as an exam, or you want to go into that? Because I get
Yes.
a lot of questions where people ask me, I haven't myself done the ADAT. Dr. Ramneek has done the ADAT. So I get a lot of questions about the actual application and how long it takes and what's the exam structure. I mean, I have a video on it on YouTube, about it, but I haven't actually gone through the process. So a lot of people could get a benefit from you shedding some light on that as well.
Yes. Yes. We'll go from there. And in the meanwhile, we have a question from Maria. University of Alberta is also taking ADAT. Yes, from 2025 fall cycle, University of Alberta will be considering ADAT scores only. Okay. So moving on.
And that means the next one, technically, because you have
Yes,
to,
not
right,
this
like
cycle.
prepare from now for the 2025 cycle. Like, am I right
But
or
the
no?
registrations, yes, the registrations are starting in University of Alberta in July 2024. So that
Mm.
means you have to take ADAT this year, like before July,
Yeah, this is
before
the part where it
November,
gets
because
tricky. So
yes.
to be ready for the July in 2020, sorry, 5 or 4, the registration.
Uh, no, 24. For a
Yeah.
fall 2025 cycle, you have to take ADAT this year, because
Mm-hmm.
their admissions are starting from July 2024 to November 2024.
Mm-hmm.
So you have to take ADAT this year to apply for fall 2025.
Okay.
Okay.
Yeah.
So coming back to which universities in Canada are accepting ADAT for IDAP. So we have 5 universities right now who have stated on their website that they would be taking ADAT. First one was McGill University. So just for your information, for everyone's information, McGill University, the registration starts from 15th of August, and the admission starts in December. So the session starts in December. So if you are planning to apply for McGill University, please take your ADAT this year and start your registration by 15th of August. Okay. Then University of Toronto. University of Toronto, the admission deadline is 2nd of July. So if you are planning to take an admission in University of Toronto, please take an ADAT this year before June, so that you are ready with your ADAT scores to apply by the deadline.
Take ADAT
Before
this
June,
year
or
before
yeah,
June.
or maximum in the first week of June. Because Dr. Hafez, what the thing is, the website says that the results will come in 3 to 4 weeks.
Mm-hmm.
My case, it came in 2 weeks, but we
Mm-hmm.
want to keep that margin. So if you give the exam maximum by June 1st week, you are ready to apply by the deadline.
Mm-hmm.
Okay. So first that, McGill University maximum, the admission cycles, like the registration cycle starts by 15th of August, as we already discussed. University of Saskatchewan. So University of Saskatchewan, the admission deadline, the registration deadline is 1st of February for this year. So if anyone who is interested in applying to University of Saskatchewan next year, that is 2025, should take ADAT this year by 30th of August so that they can start their application cycle in November or December, whatever date that give. And because the deadline is 1st of February 2025 next year. So if you want to apply for 2025 University of Saskatchewan cycle, then give the ADAT this year so that you're ready to file your application by November.
So you see, I think this is where a lot of people think that when it's on the website, on the university websites where it says like 2025, they think, oh, since we're in 2024, it doesn't apply. But
No.
to get into that like it starts from 2024, you know?
Yes.
So that's why like now they have to take ADAT now to get into the next cycle of the advanced programs, right?
Yes, they have to start the course now. They have to prepare themselves and have the space to give ADAT because ADAT is instituted only from March to 30th of August. Beyond that, ADAT is not instituted. So if we have only this much window to give ADAT, we can give ADAT twice a year in one cycle, right?
Okay.
And give yourself that margin that in the first attempt, if you're not happy with the score and you want to apply to a university, you have the time to give it second time to improve your score. Give yourself that margin.
And even March is like, I think it's March 31st. So you barely count March. That's what is that correct?
Yes.
I'm not sure. Yeah.
Yes.
So it's like, you don't have a lot of time. You have to take it maybe April, May, then June, July as a backup.
For our students, the students who are coming with us and students who are here today, I would suggest plan for April.
Okay.
Maximum by May, first week. So that once you get your scores and if you're not happy by any chance, you have the window to apply it again. Okay.
Okay, that's really good information. Yeah.
Yeah. So next is University of Alberta. Now, this is very important. University of Alberta for 2024 cycle will be considering AFK, but for fall 2025 cycle, they are considering ADAT. So anybody who is interested in applying to University of Alberta next year has to give ADAT this year because their cycle of registration is starting from July to November 2024.
So the July 2024 registration is for the 2025.
Yes.
Same thing.
Yes.
So is there any university right now that someone can still, get the AFK registration, or is that like from now there's none of them, it's already all done? Is there any date that's starting where like if someone has their AFK, they can't get into Alberta right now? Like that deadline is done.
No.
Okay.
That deadline is done.
Okay.
Yes. So it's only Nova Scotia and the Western which are left who are taking AFK into consideration right now.
Okay, so those ones are I think they're going to stay AFK,
for now,
right?
there is no information on our website regarding that.
Yeah. Okay.
So
continue. Yeah. That's good.
So for University of Alberta, if you want to get into it or you want to apply for it next cycle, please take an ADAT now and then register from July to November 2024 for the next cycle, 2025 cycle, right?
So even they have to take the ADAT exam before July, actually.
Yes.
So it's even sooner.
July or August, because their deadline is November, so they can take in July or August.
Okay, they could. Okay.
But again, I would suggest give yourself the margin to repeat the test. So if you're not happy with the score. Then University of Manitoba. So University of Manitoba has two tracks, track A and track B. So track A earlier used to consider students who have taken their AFK and ACJ, and then they are applying to the University of Manitoba for the admission. Now, from the next cycle, for the 2025 cycle, registration of which opens in November 2024.
Sorry. Is everything okay? Yeah.
Yeah. Should I go ahead?
Yeah, it's fine. Continue. Yeah.
Okay. So anybody who's interested in University of Manitoba, the cycle 2025, whose registration is starting in November 2024, please give your ADAT this year so that you can apply for the registration. You can apply for next cycle in November.
So track A is the one with ADAT. Is the track B, was it one of them still had AFK or no?
So track B has AFK plus ACJ plus
Okay.
NDECC
Oh, they added
by
NDECC now.
December. Yes, by
Oh,
NDECC by December in the same year. Like if you want to apply for track B cycle in 2025, you have to take AFK, ACJ, and NDCC this year. That is 2024.
that's
Then you
like,
can
why
apply
would
track.
you would really want the university to do that? Because once you're done NDECC, what's the point? So, I don't get that. Yeah.
But they have the option. So
Okay. Okay. So yeah, I learned a lot, Sarah. So I could look at the summary now is that so far, anyone that's interested in university pathway from this point, you should take the ADAT exam in April, ideally. Start preparing in the Feb course now. That's the ideal thing for
yes,
for getting into the next closest cycle of a university pathway.
yes. Take ADATs this year. Start with April. Give yourself the margin and start preparing now. So now is the time. This is the ideal time to prepare.
Okay.
Okay.
I guess sometimes a question which is an interesting kind of, and it makes sense. If they fail AFK 3 times and ADAT is completely separate, so they could take the university pathway now. Do you know
Yes.
anyone that? Yeah.
Yes.
So it's
Yes.
like
Yes.
because they're independent, right?
They're independent now. They
Yeah.
are not considering the AFK score now.
Okay. All right. So that's a good way to. So if you do happen to, like, if some people are in the AFK and they're going to their last, the ADAT pathway now is separate, that the university, sorry, pathway is separate from the direct pathway, look at it like that.
Yes.
Okay. There are some questions here. Do you want to take them, then move on to the next slide?
Yes,
Or do
sure.
you rather, okay. If I have not prepared for AFK yet, I'll see which ones are suitable for this slide. Is it recommended to start ADAT course starting tomorrow and start next AFK course in March? If I appear for ADAT without AFK prep, does the course cover all syllabus for the exam? So let's talk about that at the end, maybe. We'll delay that question for the end. There's still some things we just want to discuss here. How much prep time is needed for ADAT to get a decent score? An R
This I would
program.
answer.
Yep, go ahead.
Yeah. So this is a bridging course. Like when we talk about ADAT bridging course, we take into consideration that you guys have studied for AFK or have a ground knowledge or a base knowledge of certain things. So it is a bridging course, but it is a very extensive course where in 6 weeks, we would be giving you extensive knowledge of all the 3 domains which ADAT covers, like biomeds, biostats, and clinical sciences. So we would be working hard for you, and you have to equally work hard by yourself to cover all the topics in these 3 weeks. And then we will give you extensive mocks where we'll be covering all the topics from AFK and the new topics which are relevant for ADAT, give you a test and prepare you completely so that you are ready for the ADAT in April cycle. So how we have prepared the course, 6 weeks of dedicated and extensive study, and you are ready to go for the exam in April.
Okay. So
yes.
So pretty much for us, 6 weeks is the answer. I think we made it. We have an extra week like break, right? So it's like 7 weeks kind of for review.
7
But
weeks. That yes.
yeah, so 6 weeks as a content though. What is a good score? We're going to get to that slide, I think, soon. How many attempts? Dr. Ramneek said 2 attempts per cycle. So you're allowed to do twice, right? That's what I learned from you.
Yes.
2
Yes.
per year. Okay, so let's move on because I think the questions are coming in. We'll get to them after. Let's go. The slides are not too long, guys. We only have like 5 slides. So let's get through them. Let's go on. And we'll get to your questions.
So, another important question, Dr. Hafez and everyone, what everybody has in mind that how do you go about applying for ADAT, specifically for the new students, right? So, the
Yeah.
most important thing is create a dent pin. So, dent pin is a personalized ID number you create with American Dental System, with which you can apply for all the American exams. So, it doesn't take much time. You go to their website, you apply for that number, you get an email from them, and that's about it. Okay. Once you get a dent pin number, get your ECE evaluation, that is your education credential evaluation, mind it, ECE USA. Get your ECE USA evaluation done. They want a general report. So get that evaluation done. It would take you take a margin of 10 days. Like you send your documents to them and they'll send you a report back. Make sure that you tell ECE to send your digital report to ADAT directly. And if you're applying for the advanced programs, to the ADEA CAP program, like CAPID or a PASS program, how the American systems work. So wherever you want, just make sure you tell them to send your reports there. That's about it. After you receive your ECE evaluation and your ECE evaluation has been sent to ADAT, you go to an ADA website, apply to ADAT, you will receive a confirmation in 2 days that your application has been accepted. And once your application has been accepted by them, you go to Pearson's website and secure a seat for yourself. It's simple, very smooth, very simple.
I do hear a lot that's a lot easier than the NDEB process for terms of application. So like
Yes.
it sounds like multiple steps, but it's actually like
Yes.
could take like how long this whole thing takes, like a few weeks?
Few weeks. Like if you start today and you start with your dent pin and in 10 days you get your ECE done, then 3-4 more days, that's it.
Okay. So like, yeah, 3 weeks max, maybe you'd
3
say.
weeks max.
So you said the dent pin is on sorry, where do they go? I just wanted to kind of
You go to the American Dental Association website.
ADA.
So they will prompt you to create a dent pin.
Yeah. And
So
creating that is
that's
just like information. They don't require
just,
documents.
yes. No. You just have to give your information.
So anyone could do it,
Yeah.
right?
Anyone can do it.
Okay.
This is a
Then
common ID number for all the American exams, dental
okay.
exams. Yeah.
Then once you have your dent pin, you have like a profile. Then
Yes.
apply to ECE. That's a different area, right? Like a different website?
Yes, that is Education Credential Evaluation website. There are 2, US and Canada. Apply for the US one because ADAT is the US exam. So right now, like for me and for right now, they are considering US evaluation, but I would strongly suggest that thoroughly check once again, because sometimes it does change. Last time I checked, it was US. But do check once again. And they want the general report for that. There are 4 or 5 reports you can choose from. So they want the general report. That's it.
Someone saying I got course by course report done. Is it fine,
That's
doctor?
okay. That's okay. That's perfectly fine. You have just got a detailed version. That's fine.
Okay. And then once that's done, they could then just apply to ADAT, or you said you want it to be sent to the ADA or to ADAT? To the ADA.
No, so ECE will send their report to ADAT. So once you get that notification, you know that ADAT has your ECE evaluation, and then you can apply on the ADAT website.
Okay. And then once that's done, you could go to a Pearson website and book your exam.
Yes.
Okay. So hopefully that's clear to everybody. Let's see. Someone had a good question, I think it's up there that was. No, that's not valid. Oh, does the ADAT expire for the universities? I thought that would be a good question. Or is it just that each university is different from your knowledge? If you take
Uh,
ADAT now, how long is that valid for?
See, minimum 2 years. Minimum 2 years, it is valid.
Mm-hmm.
However, every university has a different protocol, which is very specifically mentioned on their website because some of
Mm-hmm.
the universities are joining now. So they would be updating their information regularly. So
Mm-hmm.
I would strongly suggest to keep an eye for every university you are applying. But
Mm-hmm.
minimum 2 years, yes.
Mm. Yeah, that's what I say too. I know in general the 2 year mark is like used to be with AFK, just with everything, but and then you have specific things for universities. I remember Western for AFK before had no expiry for AFK, but then it may have changed it now. So it's good to check the university, but the expectation is 2 years if you're not sure, right?
Yes.
Okay. We'll get to you. All these questions are interesting. We're going to get to them. Let's just move forward to finish the. So that's the application. Um, any questions specifically about this process, or should we? Let's see about this step by step here. Does the university need to send anything directly to ECE?
Your
Can you?
university? No. I
Can you?
think it
Yeah.
is,
Go ahead.
sorry.
Sorry. Go on.
No, I think it is from you. So just check. Like it is for every, like it is different for different countries and it is different for different universities, even in a particular country. So depending on your university from where you graduated, it's very simple. Just get on ECE website, look for the requirements. There's a list, and just go with the procedure. It's
Yeah.
not
So it's
difficult.
self-guidance. Yeah, it's self-guided. So just go
Self-guidance.
to there
Yes,
and they'll
it's
tell you
very
what you need to
simple.
do.
It's very, very simple.
ECE.
Probably,
Here's another question. ECE is already done. IMBDE. Do we need to get that again, or that should work?
please check if your ECE, when it was done and for how long that ECE report is valid.
Oh, they
And
expire?
yeah,
Okay.
and you have to update it. And I think so, uh, as I
I,
remember from my time.
yeah.
And however, you have to tell ECE to send your report to ADAT because when you have done it for INDB, you would not have told them to send your report to ADAT. So that you have to do. Like they charge, I think, $50 extra to send the reports to ADAT
Okay.
to an
Yeah.
additional university if you apply later on. So for that, you have to go to ECE website and
Yeah.
ask them to send your report to ADAT. Yes.
So they're asking about what the link is. Oh, they sent the link. Okay, so we're good. Omar
Yes.
sent the link. So the
Yes.
admin team. So, all right, we don't want to get into the details of the application. Like there's some things that are self-guidance, or you could ask, check on their website. But we gave you the main pathway, so it should be kind of self-explanatory once you go into it and just follow the steps, right? So let's move on with the slides. Then we'll get back to the questions.
Okay, Dr. Hafez, the most important question
Target
for,
score.
yes, which everyone asks you and me.
Yeah.
So, after reading the entire document and analyzing it, like for the reports are there on the website from 2016, 17 to 2023. So, this is what I have for 2023. So, this is a chart where they say that maximum students score anywhere between 520 and 560,
Mhm.
and highest is around 720. And simultaneously, ADAT has, we have to remember that ADAT, what this score is not the score that you are like, how many questions you have got corrected. No,
Mhm.
they have a system to evaluate each and every question. And based on that, on the grade of 10, they give you a scale score, what they call. Okay. It
Mhm.
can vary anywhere between 200 and 800, 200 being minimum, 800 being maximum.
Mhm.
So for all the three different parts of ADAT, biomedical, clinical, and DRI is data research and interpretation. That is biostat, which we are saying. So they give you individual scores for all three sections, and then they combine your score. This ADAT overall score basically reflects your clinical decision-making skills. This score, scale score, has been equated to a percentile. And like every exam, if we want to get into any good university and we want to be competitive in university admission process, we want to aim it anywhere above 90 percentile. I would suggest strongly around 95 because the competition is really increasing.
Mm. I do have kind of a theory. I don't know.
Yes.
So I know like the average is probably like around above 530, let's say. But also these scores, a lot of US people take them for the specialty, right? So
Yes.
there is a chance that the scores are in Canada are they're like at a
Higher.
different level, maybe higher, maybe
Yes.
lower, because people going for specialty, there may be more competition. Maybe here people are not used to the exam yet. So what's the highest like Canadian university score, right? So is it something we should check with the universities? What's their average, you know, acceptance, right? And a few years back, I recall it was like if you get above 530, you could get an interview. But of course, higher is better. Like if you get 600, then it's almost definitely going to get an interview, like you're saying, right?
Yes. So if we split it, like from the data which is there on the ADAT's
Mm,
website,
mm,
if you get a score anywhere from 480 to 530, you are going to get a good admission call from a specialty program.
mm.
So the Canadian scores, what I feel, are higher.
Oh, okay, I see.
Yes. And the competition is more.
Hmm.
So if we go to University of McGill's website, so they have a specific data. Anybody can access that data. So around 580 is the score average where they called people for interview. And
Mm,
around 600 something or slightly above
hmm.
that was the average score of the people who were accepted for the previous cycle.
Interesting. Okay, so it is higher here,
It
obviously.
is
So you want to
higher
try to
here.
score in that range of six,
Uh,
580 and above is good.
580 and above. How
Yeah,
we have designed, like Dr. Hafez, how we have designed the course, we discussed that.
yeah.
We want our students to aim for anywhere above 580
Hmm.
because we want to make sure that they get that admission call.
Hmm.
Now, how the admissions happen, everything has percentage, like the interview, the
Hmm.
Casper score for McGill, the psychometric analysis. Every university has their different protocols for that.
Hmm.
ADAT is a percentage of that. But we want the students get that interview call,
Hmm.
get their call from the university. So to be on a very good side, we as a team are aiming for you to get anywhere above 580. So we will try to prepare you for that.
All right. Does anyone have any questions about the score? What of University of Toronto? Please, what is the score they use to call for you interviews at University of Toronto? Do you want to share? Well, yeah, what do you think? I think
Okay.
it's the same, right? Yes, 580?
Okay. See, I got a score. I got a call from University of Toronto. Dr. Hafiz knows that. So, but I know that like I have talked to people. So it is not official. It is not on the University of Toronto's website.
Mhm.
But like talking to people, we have some information that about 540, 550, you get a call. And it can go anywhere from like to 700, 600, 650, anywhere like higher, but 450, 540,
Five,
550,
yeah.
you get a call.
So
But
some people at UFT basically they'll call you they could call you above 540 or above 530, but
550,
the higher the better. You wanna and you'll get more universities in your you'll capture more universities if you get a higher score. And don't forget things could change. Maybe it was 530, then they see more competition, then they change that. Oh, we don't want to call anyone below 560 now. Like who knows? So you want to always try to aim for higher, right? But you know, you'll have a good chance in getting a call if you get if you take the course seriously and you go for the exam, you're gonna have a good chance. And you've done an AFK course,
yes,
right?
yes. So try to aim for anywhere around 580, 600. So that means you have good clinical decision-making skills, which comply with the academic, what is, because at the end, this is an academic exam, right?
Hmm.
So what is your decision-making complies with the academic requirements of the course.
Yeah, and there's a question for those accepted, what is the score range? So I don't think that will like once you get the call, that means you kind of passed the ADAT like barrier, right?
Yes.
Then it's the interview barrier. Then it's if
Yes.
there's a clinical exam barrier. Then there's a psychological test possibly. Each
Yes.
university is different, right? So
Yes.
it's not like they'll call you then reject you because of ADAT. If they called you because you did good on the ADAT, I think that's it. You pass that line, right? And then
Yes.
it's the next steps that will kind of determine whether you're going to move on or not, right?
Absolutely.
Okay, so any questions about this? Can we could maybe move forward? It's
Okay.
interesting. Well, back in the AFK days, it was like above 85% would be a good score to look for to get into university. Now it's like an ADAT, you could say it's above 550, above
580.
580.
550.
580 is great.
Yes.
Yeah.
580 is really great.
Yeah. Okay, next one.
So next one, the other important question is how ADAT is different than AFK. So for the
Mm-hmm.
students who have already taken AFK, they have a first-hand experience, like what the course is, like what AFK constitutes, and what kind of exam you have. For the students who are new, uh, this part might be slightly tricky. So anyhow, we are going to just compare ADAT versus AFK. So the first major difference between ADAT and AFK is you have more concepts with respect to biomedical sciences. Like you would have more of physiology, you have more of biochemistry as subjects, you have more of general pathology, and you have more of concepts of microbiology, plus your AFK, biomedical sciences.
Mm-hmm.
And anatomy, which we discuss in biomedical sciences, AFK, so ADAT lays more stress on the clinical application of that anatomy, like what you read, so how you apply it in a clinical scenario. So the questions are based on that.
Mm-hmm.
So this is a difference in biomedical sciences.
So just for our AFK students that have taken the AFK and are in the ADAT, that's like translates to basic science in our AFK course. So biomedical science is like the basic science, but it's like the medical basic science, right? So basic is more expansive in ADAT, which is why we have like a full video course for basic sciences in ADAT. You'll have access to that plus the live lecture for the differences, right? So questions will be 80 in this one?
There would be 80 questions, which you have to attempt in 90 minutes.
Mm-hmm.
So there would be some questions which would be purely theoretical, some questions will be clinical application of theoretical concepts.
Mm-hmm.
So we have to be prepared for all kind of scenarios.
And Dr. Ramneek has prepared 3 full mocks for you guys, are ADAT specific,
They are
that
very
applies
extensive,
this
very
with
extensive.
full on live discussions, you know?
Yes,
So,
they are very extensive. So next is biostatistics. So when we study biostatistics in AFK, we have a good ground knowledge of what a data is, how like we evaluate few things, what are the cross-sectional studies, and how to evaluate a data, right? What are the chi-square test or a student t-test
mind
details.
you, these are the 2 things, people hate. So,
Yes. And yes, and we
I
do
love
touch,
basic science, but even epidemiology gets me sometimes, like, but it is what it is. You have to, there's the scientist researcher stuff. They want to know an ADAT that
yes,
you have, right?
yes. And we do touch base on evidence-based dentistry in AFK, like its
Hmm.
components, what it is, and we discuss about it. So basically, what ADAT wants from us as an exam is if I give you a research paper as a dentist who's practicing in the clinical scenario, should be able to analyze it completely. If there is a word in that which says regression analysis, Pearson's coefficient of correlation, you should be able to understand as a dentist what that means and how that helps you in making a clinical decision.
Mm-hmm.
Like any article which is there out there, you should be able to analyze in a way whether this is a good article, this is not a good
Mm-hmm.
article, and make your clinical decisions based on your knowledge of data, research, interpretation, epidemiology, biostats. So again, clinical decision making, but For that, you need to know the entire theory.
And that's 40 questions, right?
That's
And
40 questions
is
for
it
you,
also time limited?
45 minutes.
Okay, so it's just even. Yeah.
Yes. So in this, we would be going through all the critical points, like what each and everything means, an interpretation, and how we have to interpret what exactly is evidence-based industry, how we have to apply it, and how the questions, like we have to answer those questions. So that would be there in biostatistics.
I would say these are the biggest two main like differences, that to have 40 questions from biostats, to have a lot of focus on biomedical. Then your third category.
Your third category is clinical sciences. So in AFK, like I also gave an AFK, and you people have recently given, or some of you are studying for it. So AFK, for example, in prosthodontics and dental materials, you do go into lots of theory, right? And you have clinical concepts also. However, ADAT would particularly focus on how you apply your knowledge, theoretical and previous knowledge, in making a clinical decision. For example, they'll give you a case and treat this patient. So you have to balance what is academically correct and what is your clinical decision, like what decision you will take. So combining those two, this is what we will cover in clinical sciences, like how we have to answer those questions.
So
So
in a way,
applying,
the clinical sciences is kind of what you studied in AFK. Like that's the endo, the perio, the
yes,
however, some of it in ADAT is applied slightly differently.
yes,
Sometimes closer to ACJ, where you might have a photo of a pathology, an X-ray to evaluate. You might have a
yes.
perio chart. So you're kind of taking it from a overview point of view. Sometimes they might
And
bring
how
you
you do it, and how
cases
you do an
basically.
how do you an implant planning, how you
Hmm.
plan a complete rehabilitation case. There's multiple aspects to it. So how you go about it.
And
For
I
example,
saw while we're designing the book, like when we're
yes,
designing the book from your slides and stuff, that you had examples of that, that we're going to discuss
yes,
implant, we're going to discuss perio
yes,
charting, we're going to have, and there's a lot
yes,
of photos of x-rays and
yes,
pathology in our textbook for ADAT. And there is a textbook for ADAT that will be shipped to you guys, included in the
yes,
course as well. Okay.
yes.
Sorry, you were
So
saying an example. Someone is just complaining about the there's not enough time. The questions are 40 questions in 45 minutes barely. Did you feel like there's enough time?
you will have enough time and we'll train you for that. Don't
Okay.
worry about it.
There you go.
There
That's
will
the
be
answer.
enough time for you.
Mhm. Does
We'll
that
train
answer
you
your
how to
question?
answer.
Hopefully.
We'll train you for that. Don't worry. So for clinical sciences, I just want to add one thing,
Mhm.
that how the ADAT is designed. ADAT is designed basically to test a student how capable he or she, or anyone for that matter, would be in a program. Okay, so they test their clinical decision making skills based on their academic knowledge, which they have by the final year of their undergrad program.
Mm.
So if we are a specialist, we have to think like how an academic clinical decision making would go, which would require us to go into theory, use references, all the textbooks, and combine it with the practicality of things. So this is
Mhm.
going to be very extensive,
Mhm.
very, very extensive.
Yeah, and therefore that is one of the reasons why when we designed our program, this is maybe a good point to come in to talk about if you've kind of delivered what you want from the slide. I might discuss now here how the structure of the course is designed. Do you think it's an
Yes,
appropriate spot to talk about that here?
perfect.
What we have done is Dr. Ramneek has dissected our AFK course, and also for her knowledge from the AFK course herself, note, and from her knowledge of ADAT, has taken out what is different, right? So ADAT is going to focus on what you do not learn in AFK in general, right? However, we still reteach you everything related to these from our AFK, right? So when it comes to basic sciences or biomedical sciences and biostatistics, you're still going to get you're going to get a full video access to over, you could say, like, at least for basic science, it's probably 15 hours of video content, and biomedical is probably going to be I forgot the hour number. It's probably around 7 or 10. But then on top of that, you have one full lecture day for basic sciences ADAT. That is a live lecture that will be in the ADAT course. One full lecture day for biostatistics, specifically for ADAT biostatistics. And this is where your AFK knowledge comes in, is that you have to review the clinical sciences. It's recommended you review it before you come to the clinical science class. And then here, what we're going to do is we're not going to start over because you won't have enough time to go over. You need 6 months, right? Like just like AFK to actually go over all the clinical sciences. So in ADAT, what we're going to do in the course is focus on the lecture day of the ADAT specific things that you need to learn for the clinical sciences. And we rely on you to review your AFK knowledge, so we'll refer you back to it. Now, it's ideal if someone taking our AFK course because it's going to fit perfectly. And also, if you have taken another AFK course, we'll refer you back to your content to, study your foundations of the clinical sciences, and then just attend the live lecture with us and also the mocks, right? So that, like the course basically, but that's what you're going to learn in our clinical sciences. That's what we're going to do. Therefore, we're not going to go into each, topic. I don't want to say it this way, but we're not going to start like you're going to have a 5 months course for ADAT. That's why if you haven't done anything, ideally you want to do our AFK and ADAT together. Does that make sense? I'm not sure if I communicated that the best way, Dr. Ramneek. So if you want to jump in as well,
Yes.
let me know. I could, and I'll show a course preview at the end as well. So
Yes.
go ahead. Yeah, if you want to say.
We what we recommend is have a good base of AFK, then we build on it, and that's how we want to go about it. So
Mhm,
anybody who has not taken AFK, as Dr. Hafez said, we would recommend you to take both together
mhm.
because that would be best for you.
And to show
We
you how
want,
that looks on a timeline, you could, sorry, go on and I'll just draw the
no,
timeline as
please
well.
go ahead. Go ahead.
So if you've taken the September AFK course with us, right, then you're in a perfect position to do the Feb ADAT, because that way you're done AFK, you take the 6-week ADAT, that's it, you're upgraded, and then you could do your exam in April. Now, if someone's coming to us now that hasn't done the AFK at all, then there is a way around it where you would take the Feb ADAT and then you take our March AFK. Now it is in reverse, but this is the only way you could get into ADAT this year with a high success rate, right? So you take the ADAT in course in Feb, and then the March AFK course. Now, the further you push maybe your ADAT exam in this scenario, maybe you can't do it in April, maybe you might have to do it in July, then the more clinical science knowledge you're going to gain from AFK. Does that make sense? What would you recommend in that scenario? I feel like because April will be probably too soon for the red scenario,
Yes. So so this we are discussing for the people who are taking AFK and ADAT together, right?
Yeah, so if
Yes.
in the blue zone, like here, what I'm saying, where they're taking the September AFK, then the Feb ADAT, those guys are perfect to go into
Perfect.
the April exam.
Perfect.
And
Perfect.
then if they have another
Perfect.
chance to repeat, right?
Perfect. That's a perfect scenario.
That's a perfect scenario. Now, people that have not taken AFK but still want to do ADAT this year, then they would have to do the Feb ADAT and March AFK.
Feb ADAT and March AFK. Yes.
Yes, it will be in reverse, but
Yes.
now they need to catch up on clinical sciences, so it might be beneficial to push the ADAT exam a little bit further.
Yes. So for those, Dr. Hafiz, I would suggest that give it around 15th of July, because by that time you are ready with your AFK, you're ready with your ADAT. And if you give it in 15, like post 15th of July, still you have 2 or 3 universities where you can apply in that cycle, whose registrations are starting in November. So you're in a good spot with respect to those also. And if you want to apply for University of Toronto for that matter in next cycle, you can apply. You
Yeah,
have good chance to review.
so that would be
You,
like your
you,
target date, but there's no harm in trying one since you get 2 a year. But like that's you most
it's a
likely
good,
you're going to do very well on the July date in
very
that
well,
scenario.
very well, because you would have entire knowledge with you. You would know how to apply that knowledge, and you would be ready for that. So 15th July to 30th of July would be the right time for you people to go ahead with the exam.
Okay, so we already said that. So one good question here this is probably important to address. Please, let's say someone does not plan to take AFK. For those who do not have AFK experience and have not written AFK, can they still pass ADAT and get high score? Please, what is the best advice for someone like this? So from my point of view, okay, if you're not planning to take AFK, you still should take the AFK course because it's part of the ADAT overall course. Does that make sense?
Yes.
Like, think of it like this. If I took the AFK course that we have that starts in March to August, okay, that clinical sciences in there, we could add it to the ADAT and call it a 7-month ADAT course. We're doing that in a way. So we're telling you take the ADAT add-on plus the AFK to get good score on ADAT.
Yes.
You don't have to take, just because you're taking the March AFK course, it doesn't mean you have to take the AFK exam. It just means you're doing the complete study you need to do the ADAT exam when you take both. So the ADAT exam requires from scholars both ADAT course and AFK course. Because the ADAT course is a bridge course, which means the AFK course works towards your ADAT exam. Is that clear? So don't be set in this mindset that just because we label it AFK course, that means you have to take AFK exam and it's not for ADAT. The AFK course is called, actually, from our educational point of view, is actually called the Foundations of Dentistry, but for AFK, and then it's also used for ADAT.
Take the Foundations of Dentistry course, build a foundation, and then build on it to give your ADAT.
Exactly. Now, we're going to do a Feb-March cycle for this year. That's the idea. So are we going to do another cycle after? We don't know. It depends on how many, because the best ideal scenario is Feb-March. But if people keep pushing us to say, can we do another cycle? We could probably fit another one in, right, Dr. Ramneek? Maybe around like April, May, or May, June, or something like that.
Yes, during that.
But that's not guaranteed. So we haven't launched that. We like things to be done in a very systematic way. So we found the Feb cycle is the key spot for doing ADAT and where it fits with our AFK courses as well.
And I want to add one thing, like when you are registering for our ADAT course, so I would recommend that you register for AFK for next batch, because then you would have access to good amount of knowledge, right? You would be attending the ADAT live lectures and extensive mocks, which we are giving, and simultaneously you would have access to all the knowledge which is available with our Foundations of Dentistry or our AFK course. So have both together.
Exactly. Our AFK course is a weekly model.
Together. Yeah. Yes.
Yeah. Exactly. So you would have, I could just show them. Let's see. Is there one more slide, or are we?
Yeah.
Oh. Then I could show them an example of how the ADAT course looks like as a platform. Oh, maybe I could do that now. Let me see here. Yeah. Sorry about that. It's a good spot. So I'm gonna. Is it okay if I share?
Yeah, sure.
Just to give them. I'm just gonna share. I'll take over here just to show them how. Sure. So here's our ADAT. So once you register for our ADAT course, you guys see this? Okay. So you'll have access to this platform. Okay. Okay. So, understood. Yeah. So we have until like our ACJ orientations at 12. So we're good. Yeah. So just to show you, of course, some schedule, just showing you the schedule. Module 1, Module 2, Module 3, review week, Module 1, Mock 1, Mock 2, Mock 3. This is the ADAT plan for our course. So Module 1, which is tomorrow, you're going to do a live session, which is Introduction in Biomedical Sciences. So you're going to focus tomorrow on the basic sciences for ADAT specifically. Then that will be recorded. If you missed it on Sunday, which is tomorrow, you'll have the week to watch it. You'll stay on the platform, so you could watch it later. Then the Sunday after, you're going to have your live session of biostatistics. Okay, let me just get this. Oh my God, okay. So the biostatistics, which is going to be the Sunday following, also same thing. You're going to focus on that, and then you're going to, it's going to be recorded, and you could watch it if you missed it. And then on February 25th is the, and then on February 25th is the clinical science lecture. And that's where Dr. Ramneek is going to go through, a quick review of all the subjects in dentistry that are mainly clinical sciences. So you're going to do a quick patho, radio, perio, right, prosto, all that, and apply it to ADAT. I saw how you have like all the main points that you want to show as well.
Yes. Yes.
Then you're going to have a week kind of where it's just review. So you'll have like a chance to maybe ask questions, review things that Dr. Ramneek wants to review. Then 3 full mocks, which are going to be the key, I think, at the end of the day, to learn how ADAT feels like, where you have 3 full 200-question mock exams. And on Sundays, you're going to do a full discussion that could be lengthy, but that's what you're going to need to be prepared. So that's the schedule. And you can see here, module 1, you'll have, a guide to show you what videos to watch from our platform here. So you have access to our AFK basic science, so that all the basic science from AFK is reviewed here, which is possibly around like 12 hours of video. And on top of that, then you're going to have the live lecture. And we have a guide telling you from Dr. Ramneek what actually to focus on, what's very important, right? Then you have the epidemiology and ethics videos here, which is also taken from the AFK, but all of them here. So you get a fresh start with basic sciences and epidemiology, so you do well on those. And then those will be discussed in the live lesson. Okay, so those are at the end here. Then you have the mock 1, which is you have access to when the time is when we're ready for it, and mock 2 and mock 3, and then the live sessions. So that's access to the ADAT, right? Now, if you take the AFK course, it's a bit different. Please ask if you want to inquire about the AFK course. We have a different platform for it. And people that have done the AFK with us, you don't need to actually do it again. Just review your content from the books, right? But from the AFK course, it's just a little bit more extensive. So you could see that, you get the AFK books, you have the same 2 modules, epidemiology and basic science, that you'll have in ADAT, but then you have pharma, all the clinical sciences, patho, anesthesia, dental materials restorative, all of them in 14 modules, right? And these are not all open at once. We have a different AFK strategy. So if you want to watch a video about that, maybe Omar, you could link how our week of AFK works in the chat. Okay, so if you've done our AFK course, you don't need to do this again. You just have to review your books and stuff, and then not even your release questions, just the books, because the release questions are AFK specific a little bit. What would you recommend for that, Dr. Ramneek?
Sorry?
Like if they're reviewing their AFK content, they could just focus on the books. They don't need to go to the questions and release questions, maybe?
No. So that part, in the live lecture, we would be telling them, like, they have the access to videos, and I would be guiding them that this is what is important from the video. They don't have to just do it everything again. So what is important for them, where they have to emphasize on, so we will just guide them through that, plus the additional what is required for the ADAT. So we will guide them through everything.
Because
regarding
I'm talking about our AFK students that already took the course and now they don't have access to it. They have access to the ADAT only, so they could go back to their books.
They can go back to their books. Yes, they can go back to your books.
Okay.
Yes.
And if you have taken an AFK course somewhere else and coming here for ADAT, that's where we don't know how the harmony will be. Like you'll still be benefiting, but most AFK courses are covering the same content, I would say, almost. It's mainly in the way of delivery and the explanations that maybe we have unique to us. But and I don't know, I can't speak for everyone, but like that's where we would refer you back to your AFK content for the clinical sciences that come in. You're still going to get the how do you say, the high yield concepts in our ADAT course, right?
Yes.
Now, if you haven't done AFK at all, then I don't think you could just rely on our bridge ADAT course. That doesn't make sense, right? So you should do the ADAT plus the AFK. That's now a complete ADAT course, okay? So becomes like a complete ADAT course in a way.
And yeah, I want to add one more point for the students who are from different institutes who have not taken an AFK course with scholars, but have already taken AFK. You would have access to Scholars Dental videos, which we are giving you access as a part of ADAT.
No,
please
only
do
the
watch
basic
them.
science and epidemiology.
Only the basic sciences, epidemiology.
Yeah.
And for clinical, please review your AFK notes. We may not be discussing those topics in the live sessions because we have too much to discuss. It's very extensive. However, when we give you mocks, So at that point of time, we have all the AFK concepts and all the ADAT concepts combined together for your ADAT exam. And at that point, we would be reviewing everything. So at that point of time, if you have any like difference in concepts and everything, we can always discuss that.
Exactly. So for our students that took the AFK course, you have an alumni package. So you could contact the admin team. They could send you and refer you how to get to the alumni package, alumni discount package. We also have, you know, if I want to just try to guide you on how this, because some people are asking about, and then we want to get to the Q&A. So I want to get to that before our ACJ orientation as well. But let me get to showing you our packages so it's clear, because I know that's probably something they have in mind. So if you go to our website and you see the ADAT packages, now if you do an ADAT Feb course with the AFK March course, which is in this year, right? Back to back, there's going to be some overlap. There is a package deal where you could get a discount with that, right? If you have already taken the September AFK, you will get an alumni discount for the ADAT. Just you know, ask the admin team to guide you. You go to the alumni page. And if you are just taking the ADAT and you've never taken a course with us, here's the one for that, Feb 2024 ADAT right here. Okay? So, but if you haven't done AFK at all, then you should go for this one, okay? The ADAT/AFK package. Okay, guys? So that's pretty much the guide here, I think. Was I clear, Dr. Ramneek? Did I miss anything?
Yes.
Okay.
Yeah.
So go on, Dr. Ramneek, let's complete the slides, and then we can get to the Q&A.
So I'll share the page once again.
It's like one more, so.
Yes. 1 second.
Ooh.
Sorry about that. So we'll go to. So, this question has been more or less answered during all our discussions, like how like how to approach ADAT. So Dr. Hafez has like discussed everything. So as an instructor, what I would request anybody who has joined for ADAT and who would be joining tomorrow for ADAT, like new students, uh, put in as much effort as you want, like put as much effort as you can. So these 6 weeks or 7 weeks for that matter could include extensive study from your side and extensive effort from our side to prepare you for that April exam, where when you go, you're confident that you know everything. You have covered everything. So we would be coming live on every Sundays and giving you knowledge about how to read and what to read from your AFK, and what new concepts are there in ADAT, how to approach ADAT during all those live lectures. Some points, like somebody asked, like there are 40 questions and there are 45 minutes. So those small points you will learn during those live lectures. So I have specific points for that. Time is short. What to do?
That's awesome.
How do you answer your biostat questions in such a short time? So you will have all those points. So please attend your live sessions, study extensively during the week, be prepared with your question answers. We are always there to answer that, and attempt mocks very seriously because they are extensive and they will just catapult you to a stage where you will be very confident to sit for your ADAT exam in April. Very sure of that.
That's awesome. By the way, just to add, like, this is just people that took, before we started this ADAT course, people that took the AFK course and just did a little bit of self-preparation scored well on ADAT already, you know? So just taking the AFK course, they went and passed the IMBDE. They got, I think the people that reported to me that did ADAT got around 530. So now having the 6 weeks on top of the AFK, I don't know. Like, I think I'm expecting, you know, some high number. Like, it
I'm
makes sense.
expecting minimum
It makes
600,
sense.
Dr. Hafez.
Yeah,
I'm
minimum
expecting
600.
minimum 600. Yes.
Like like, see how much you're getting. If you've done the AFK course September with us, that group of people, I don't see a reason why not to add this extra, like,
Dose to
topping
that,
your knowledge. Like, even knowledge wise, you're gonna advance more. get that record of ADAT. It'll still always say, hey, I got the ADAT and I scored this. It'll always be on your record in a way, you know. But if you could, why not do it now? You never know if the direct pathway blocks somewhere, you have that you could go to the university pathway, have that experience. So, and it's not a longer, like it's 6 more weeks, right? So I think just with the AFK course, people were doing well, but now with the ADAT's add-on bridge, like it's going to be, you know, it's going to catapult you like into a higher score if you take it seriously, of course, right? We're taking it seriously, so we just need you to take it seriously. Okay. So I think that's it. You want to get to the Q&As?